The person who does what the president says do. I'm the vice president for academic and student affairs for this university, and it is such a pleasure to just take a few minutes to greet you all on behalf of President Bennett and also our faculty, our staff, and our student body. You know, just really excited about you all being on our campus now for the 7th time. I think this is yeah. You deserve a round of applause for that, boy. I was just talking to Katie and Rhonda. I wanted to really thank Swerker and Moore for partnering with USI with this important endeavor. This is just incredible work that you're doing. I was walking over here with a colleague from campus, and this colleague is about the same age as I am. I may be a little older than my colleague, and I said, you know, what's one of your takeaways for the conference so far? And my colleague said, well, it sucks when you get old. And so I was thinking to myself, wow, you know, that's the only takeaway? I said, no, that's not the only takeaway. It's been informative, it's been enriching. It's also been wonderful just to meet new people within the community who are just so empowered about learning new skills, about how to support our community. And so, you know, we talked more a little bit, and I said, well, it's much better than the alternative of not waking up, you know, the next day. And I'm thankful for this kind of conference for several reasons, but I was just saying to Rhonda, I don't get very personal all the time, but you know, I lost my mom right before I moved here to become provost, and it was interesting because as a son, I became a caregiver overnight. You know, she fell ill, and I'm the oldest of 3, and I've always been that child in the family where, you know, you fix it, you make sure it's right, you get it done. If it's not right, the belt is yours when we get home, you know? And so I felt that way about my mom, taking care of her as well. And it was interesting because, you know, Rhonda said, well, Ron, did you feel lost? Did you feel like you had the resources you needed? And for me, you know, I have lots of resources because I'm in this academic community, so I've always had people to call when I needed assistance or some kind of advice. But I wasn't that at all. I was in denial. I was resistant. You know, I was not ready, you know, to lose my mother. And so I was just saying that the one agency that I resented most for me personally was hospice. I didn't want hospice around me. You know, I just felt that it was one message of me giving up and letting her go. And then one day, we were in Atlanta, Georgia. I'll never forget this, when she was staying, and then I moved to Buffalo to live with my wife and I and my children, and I met a new woman. And she came to our home because she heard about my mother, and she was from hospice. And immediately you could just read my affect, like, go away. You know, I do not want you in my life. You may not see my mother. You are not welcome here. And this woman was amazingly persistent. She was so intuitive. She was so highly skilled and so highly competent that she reduced me to tears immediately by saying, I am not the angel of death, and I'm not here to take your mother away. I'm here to support you, your family, and your mom, most importantly. And sir, if you allow me to just talk to her, let me support your family, and if you don't want me here after that, I will never bother you again. And I'll tell you right now, it was the most welcoming opportunity for us to receive assistance, because I didn't realize how tired I was. You know, I was just nonstop moving. And now all of a sudden I had this support system. And the funny part of this is that one day hospice came to our home, and they gave my mother a massage. And when the lady was leaving from giving my mother a massage, she said, ma'am, is there anything else I can do for you? You know, she said, well, you know, should we have other services? She said, you got other services? She said, you know, yes, let me leave you this menu of services. And she said, tell my son that he's been preventing me from getting good treatment. So now I'm the bad person, right? So I guess, you know, the story I'm sharing with you all is that your work is so significant. It's just so incredibly important. And I close my welcome by telling you one other thing that I learned recently. I have a mentor. I did my PhD in Illinois in Champaign, and there was a professor that just admired so much. He's a reproductive physiologist, and he took so much time with me personally in the laboratory, teaching me methodology. And he's now retired. He's an emeritus professor. And I went back to Illinois recently, and he was there, and I got to visit with him. And he no longer has this grand office. They moved him into a desk in a corner in another facility, and I saw him, and I asked him, I said, "Sir, how are you?" And I never forget this, but he said, "Ron, I'm no longer relevant. No one talks to me anymore." And it gave me such incredible pause about this notion of dignity. You know, what can we do as we support people, whatever age bracket they're in, to always help them understand when they're wanting to work and contribute, that they are relevant, that they are significant, that they have value, they have meaning. And for me, this conference represents that. So listen, let me stop. I can go on and on. I'm getting excited over here, about what you're doing. And I want to just thank you so much for taking time to visit our amazing campus, working with our community partners. If you ever see me in the community, please trip me, stop me, say hello to me. I love speaking to people, talking to people, making new friends. But welcome to USI. Welcome to the conference. Have an amazing, amazing day. And thank you for allowing me to share just a brief introduction and welcome to you, okay? I want to introduce Katie Ellman and thank her for coming forward. Have a great day, everyone. Thank you.
Good morning. Thank you, Dr. Rashan. My name is Katie Ellman. I'm an associate professor of gerontology at USI and the director of the Center for Healthy Aging and Wellness. And I just want to go over a few details before we introduce our speaker. First, I want to recognize our co-providers this year of this conference, Deaconess Health System, Evansville Protestant Home, and St. Mary's Medical Center. Our corporate sponsor is Holiday Healthcare, and our break sponsors include the communities of Solebron, Caregiver Homes, and Trilogy Health Services. These co-providers and sponsors really help us bring these speakers in that we were able to bring this year and support the funding for a conference like this, so thank you to them. We have over 30 organizations who have paid a fee to display over the 2 days of this conference. After our morning presentation, I would invite you to visit these exhibitors, which are located on the UC East. Follow the hallway down and across to the other side of the building. I have a few announcements about our concurrent sessions today, which is right behind me here. The first one, in concurrent session 1, if you are signed up for the benefits of dancing, that session will be held in the lower level of UC East. It is in this building, so you don't have to go outside, but some people may not know where that's located. So if you would like to meet at the registration desk at 10:20, we will have someone there to escort you to the lower level of UC East. Concurrent session 2, pickleball. If you're signed up for pickleball, this session takes place in the REC, which is the Recreational and Fitness building here at USI. We will have students, our two golf cart student drivers, meet you at the registration desk. And you can either ride in the golf cart or you can walk with the group over to this session. And if you can meet at 12:05 at the registration desk if you're signed up for pickleball. And finally, concurrent session 3, Women Protect Yourselves. If you're signed up for this session, again, it's in the UC East lower level. And if you could meet at the registration desk at 1:25. We just wanted to do this just to help in the kind of the directional getting to where you need to be. But if you know where you're going, feel free to head on over on your own as well. Karen Williams was scheduled to speak during concurrent session 1 today. She is not able to be here. She is speaking on advanced directives. We have a replacement for her. Catherine Ryback will be speaking on the very same topic in her place. So I would invite you to attend. You will get a quality presentation on the very same topic. Please tweet your thoughts about the conference at #MAIARocks. And we have a new app this year that we're using. This is actually my first time using the app. I know our outreach and engagement has used it for another conference. I hope you're enjoying the app. I'm finding it's just great to have everything right there on my fingertips. If you need directions on getting Wi-Fi to download that app, I've got the password and login right above, right on the slide here, or you can stop at the desk, registration desk, and there will be somebody to assist you to download the app and to get on Wi-Fi. If you, we would invite you to complete your online evaluation form. In order to receive your continuing education credits for this conference, you'll need to complete the evaluation form online within the next 2 weeks. And you were emailed a link, I believe, sometime in the last 48 hours, and you just click on that link and you can access your evaluation that way. You can also access your evaluation from your app as well. If someone, and there might be some people who absolutely have no access to a computer or wireless or the internet, and if that's the case, if you want to just go to our registration desk, we will try to set up a time where we can help you go through, set up a workstation for you to do the evaluation in that way here on campus before you leave today. Some of our sessions will be audio recorded, and you should be able to get access to those audio recordings if you want to listen to any of these or share any of these with friends or families or coworkers by going to usi.edu MAIA 2014. Once you go to our conference website, which is listed there, if you can look for the 2014 archive page, it's already set up, and what we will do is plug in those audio streams in the next little while. So feel free to take a look at those if any of these presentations resonate and you want to share them with friends or family or coworkers. Lunch will be provided in the loft, and the loft is the eating area right next to the registration desk, basically on the other side of Carter Hall. You'll notice it because all the food will be on the tables there, and just find a seat and enjoy your lunch. Of course, cell phone etiquette, if you don't mind turning off your cell phones, that would be super. I realize some of you still have business to attend to, so feel free to do that, but we just ask you to go out into the hall. So that's all the details, and without any further ado, I'd like to introduce the CEO, President and CEO of Swerka and More, and she is going to introduce our morning keynote. Let's have a great day. We have a very exciting day today, and we're pleased to have all of you here.
Good morning, everyone. Board certified in cardiovascular disease, internal medicine, nuclear medicine, and holistic medicine, Dr. Guarneri is president of the American Board of Integrative Holistic Medicine and serves as senior advisor to the Atlantic Health System for the Center for Wellbeing and Integrative Medicine. Dr. Guarneri is founder and director of Guarneri Integrative Health Incorporated and Taylor Academy for Integrative Medicine Education and Research located at Pacific Pearl La Jolla in La Jolla, California. Dr. Guarneri was an English literature major as an undergraduate at New York University. Her medical degree is from SUNY Medical Center in New York, where she graduated #1 in her class. Dr. Guarneri served her internship and residency at Cornell Medical Center, where she later became chief medical resident. She served cardiology fellowships at both New York University Medical Center and Scripps Clinic. She is a fellow member of the American College of Cardiology, Alpha Omega Alpha, and the American Medical Women's Association. Dr. Guarneri founded the Scripps Center for Integrative Medicine and served as medical director for 15 years. She began her career at Scripps Clinic as an attending in interventional cardiology, where she placed thousands of coronary stents. Recognizing the need for a more comprehensive and more holistic approach to cardiovascular disease, she pioneered the Scripps Center for Integrative Medicine, where state-of-the-art cardiac imaging technology and lifestyle change programs are used to aggressively diagnose, prevent, and treat cardiovascular disease. Dr. Guarneri is the author of The Heart Speaks, a poignant collection of stories from heart patients who have benefited from integrative medicine approaches. The Heart Speaks and her clinical work have been featured on NBC Today and PBS's To the Contrary in Full Focus. Her work was also featured in a 2-part PBS documentary, The New Medicine. Dr. Guarneri has been recognized for her national leadership in integrative medicine by the BraveWell Collaborative and has served as chair of the BraveWell Clinical Network for Integrative Medicine. In 2009, Dr. Guarneri was honored as the ARCS Scientist of the Year. In 2011, Dr. Guarneri was the winner of the BraveWell Leadership Award, which honors a physician leader who has made significant contributions to the transformation of the U.S. healthcare system. Most recently, she received the 2012 Linus Pauling Functional Medicine Lifetime Achievement Award from the Institution for Functional Medicine and the Grace A. Goldsmith Award from the American College of Nutrition. So please join me in welcoming Dr. Guarneri.
I just said, who is that person? Good morning. I am wondering what happened to that lavalier mic. Ah, there it is. We might see if we can get this to work. I don't know about you, but the energy exercise put me in the right space, right? That was just terrific. Yeah, can we, some magic there? Need some energy? There we go. Okay, good. How's that? You see, I have two disclosures. The first is I'm Italian, so I have to move. The second is I grew up in New York, so I have a New York accent. And you guys hopefully will not hold that against me. So if I come out here, can you hear me? Great, all right. Any opportunity to dim lights at all, or would that put us all to sleep? Maybe? Maybe partially? Okay. Well, you heard that I began my career in the 90s in the cardiac cath lab. So at that time, this was my paradigm, blocked coronary arteries. How many of you work in the hospital? This is what we're really good at, right? Someone comes in, they have chest pain, we rush them to the cath lab, we pull out our toolbox, and we say, okay, we're going to get that artery open, or in this case, a vein, and we're going to put a stent in, and that is one of the miracles of modern medicine. What I wasn't thinking about in the 90s was, why does this gentleman who comes in and has a stent, has already had a bypass, right? 5 years later, he's coming in and having a stent. So what's the disconnect between the great intervention we do and the opportunity for prevention that we were frequently missing? Well, furthermore, I would go up to the ICU, and I would make rounds with the team, and my patient would be getting what for food? A roast beef and mayo sandwich on white bread, right? So here I just put in this stent, and I have to be honest, you don't know what you don't know. I wasn't even thinking about the ridiculousness of this scenario at the time. Well, when we look at the data on how we're doing as a country in healthcare, and believe me, I don't want to live in any other country but this one. But when it comes to healthcare, if we look at places like Mexico, this is spending here, right? So they're not spending a lot of money. Poland's not spending a lot of money. South Korea, and so on. Now, this over here are some of those Scandinavian countries like Sweden and Denmark and Finland. So this is cost of healthcare, and Switzerland is over here. And guess where the United States is? All right, so we're looking at $4.5 trillion being spent on healthcare. So now you're going to say to me, well, that's okay, because we live longer. All right, well, let's take a look at it. So if I'm living in the UK, I'm over here in my expenditure, and I live to about 80 years old. It's different for men and women, but if I'm in the United States and I'm spending up here, it's down here. So this argument about spending more leads to more quality of life, leads to longer life, isn't exactly true. So to me, I began to think about it this way. I said, I was trained in acute care. What are the strengths of conventional medicine, right? So if you need that stent or surgery, or you get hit with a truck, you want to go to a trauma center. That's not the day you say, let me learn yoga, right? That's the, right? you may like to, but you want to be in a medical center. You want your antibiotics, your diagnostics. This is where we're really good. But this is what we end up doing. We start to see the world through that lens. What do I mean by that? Someone comes in and they say, I have a pain in my knee. What do you diagnose? Arthritis. And you say, oh, here's your pill, Motrin, Advil, or Leaf. Now somebody comes in and says, every time I eat, I get a little burning over here. What do you diagnose? Reflux, heartburn. Everybody's saying it. Oh, I got a pill for that too. Here's your H2 blocker, your Nexium, your Prevacid, all that other stuff. Now someone comes in and says, I have high blood pressure, and you say, oh, I have a pill for that, or I have 6 pills for that. So what are we doing here? We're naming it. I have a burning here. I know the name, heartburn. Reflux. We're naming it, we're blaming it, and then we're taming it with a drug, right? So we have this ill to the pill thinking. And so by the time someone comes to see me, they have lots of ills and lots of pills, right? So when we think about the ill to the pill, you know, it just keeps escalating because somebody then comes in and says, well, I'm depressed because I have all these diseases. Well, then we give you an antidepressant, right? We need a new way to think because this model, when somebody comes in and is having a heart attack, great, get the stent, the cath lab, you know, all the Plavix and the aspirin and Riopro, whatever it takes to save a life. But if we apply that same model to chronic disease, we end up with each diagnosis being a distinct entity that we then say, ill to the pill, let's give you a pill. So I have a habit. I say to my patients, why don't you bring me in, new patient, I want to see everything you take. Every vitamin, supplement, herb, and prescription medication. So I'll show you in a second where that leads me. So we spend $210 billion on pharmaceutical therapies. And you know, we're one of the few countries in the world that allows those commercials at night. Do you have them here in Evansville? Right? And when someone can tell me why that Cialis commercial ends in a bathtub, I must be very slow in my thinking, because every time I see it, I cannot figure it out for the life of me. So we spend $210 billion on pharmaceuticals. The biggest ones may shock you. Antipsychotics, antidepressants, antacids, and cholesterol-lowering statins, right? So the country, based on these numbers, is psychotic, depressed, has heartburn, and high cholesterol. And I'm going to tell you, we have to think differently. It just doesn't make sense. So in comes my patient. Oh, here's my pills. Hey, this is a 1-hour appointment. I can't get through all of this. Oh my God. And this is a dentist. You might say, oh, this uneducated person. This is a dentist. I said to him, how'd you get all this stuff? He said, oh, I have good insurance. I go from specialist to specialist, and I get something from everyone. The ill to the pill, I get a prescription. And then you'll notice in the middle of all of this, he's got something called slippery elm for heartburn. Is there any surprise he has heartburn, right? Well, Mark Twain said it best. I stole this slide from my buddy Patrick Hanaway. Mark Twain said, it ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. And in the 90s, I thought I was curing heart disease with a stent. And I never thought for 1 second that I was just fixing a small segment of the artery, 13 millimeters, 20 millimeters, 8 millimeters, forgetting that the entire body has blood vessels, and I was doing nothing to turn off the faucet, right? So I didn't know what I didn't know. That's the bottom line. So I was sort of mopping up the mess and missing the tsunami, right? Well, we know this. We know that genes are just the tip of our iceberg, and I'll explain that to you in a minute. But who's heard the term epigenetics? Well, so the genes are your book of life. Mom and Dad gave you 23 chapters in your book of life. Those are the genes you were born with. So think of the genes as my arm. Now think of your epigenomics as my sleeve. This is what washes over the genes. So think about the food you eat trickling down. You know, your genes don't see a donut. Your genes see the breakdown of the donut, right? So think about epigenetics as your life interacting with your genes, turning genes on and off. That's what we know today. So we know that we are way more than our genes. And 70 to 90% of the diseases we see, which quite frankly we label as part of aging, right, are related to lifestyle and our environment. And when we talk about lifestyle and environment, it's everything. It's what do I eat, but it's also who do I eat with, right? You could eat all the Brussels sprouts in the world you want and say, these are good cruciferous vegetables which are turning on my phase 2 liver enzymes for detoxification. But if you're eating them with anger in your heart, revenge, they're probably not going to help you, right? So it's your lifestyle and your environment that accounts for 70 to 90% of what we see, and I'll show that to you. Well, the ironic part about this is when you read the medical literature, this is what the Journal of the American Medical Association had to say. Medical education should prepare students for the problems they will face in their future. That is not happening. The most prevalent problem is chronic disease. And I'm here to tell you it's totally preventable. Right? I'm not saying it's a little preventable. It's totally preventable. But the way we prevent it is with your participation. I say to my patients, yes, I can give you supplements and nutrition and personalize your care, but it's personalized, it has to be proactive, and it has to be participatory. I need your participation, or I can't do it alone. So this is what we're seeing in the world. In 2009, the World Economic Forum said that chronic disease is the greatest threat to global economic development, right? Here we are as a country. Now, these red states here, and I'm not going to pick on you guys, but these red states here are not Republican states. They may be Republican states, but that's not what this is about. This is about how much extra weight the state is carrying. So if you see a red state, that means greater than 25% of the population meets that definition of being obese, right? And if you see this strip here in orange, greater than 30% of the population is meeting that definition. Now, take a look at one lone state here, Colorado, is hanging in there with 15%. But I will tell you, when the munchies kick in on that state, we're going to see what happens. I'm waiting to see. I'm just going to wait and see. Well, we know that extra weight we carry is not just, gee, I can't bend down and tie my shoes and all of that. It's really about being an endocrine organ. And it's an endocrine organ that sends out all these, you know what we call this? We call this rage fat. It's enraged because it sends out all these signals that say raise blood pressure, cause inflammation, which leads to arthritis, Alzheimer's disease, dementia, heart disease. Oh, inflammation here. Raise the blood pressure. It just produces all of these elements, what we call cytokines, just by being there, just by virtue of being there. So we don't even have to do anything else if we're carrying that extra midline weight and our blood pressure is up and we're inflamed. We have arthritis. We start to lose our memory. We develop diabetes, and so on. So in a minute, we'll go through why food is medicine. So when we think of chronic disease now, we say, okay, how do we prevent disease? Well, let's look at our environment. What's it made of? Toxins, right? We'll come to toxins later in the talk. Stress. How do I respond to stress and tension? Am I angry? Am I hostile? Right? Or am I doing my Tai Chi every day so that when life throws me a curveball, I say this too will flow? Right? So how do I respond to stress and tension? What am I eating? Am I physically active? How much drugs and alcohol am I putting into my body? I'm so tired of hearing people tell me, oh, Dr. Guarneri, alcohol is good for you. I say, yeah. 1 4-ounce drink a day for men, 3 for women, at the most, not 2 bottles a night, right? You laugh, but I hear this. Trauma. And by this I mean emotional trauma, right? Adverse childhood events. You may not know this, but beautiful research has been done that shows that children that grow up in households with fighting and yelling and parents in jail and just disruptive environments end up being the most addicted later in life, right? Why? I need that comfort from this box of donuts. It makes me feel good. These 20 friends in this pack of cigarettes, these are my friends. Why do we call it comfort food, right? Because it makes us feel good, and the brain, it's sending signals to the brain to release dopamine that say, this is pleasing, oh, this feels better, right? These are the areas in medicine that we forget about. Radiation, all of these things interact with our genes and determine whether or not we become healthy and stay healthy or we get sick. Is everyone with me? So it's not just when people come out and say, oh, put statins in the water and everybody take a statin. I wish it was that simple. It's not. But this is simple when you break it down into practical pieces. So this is a kind of scary picture of epigenetics. This comes off the sheriff's website. This lady looked like this in 2001. She looks like this in 2008. Look at this gentleman, 2000 to 2007. This is epigenetics at its worst. If you put drugs, alcohol, the wrong foods into your body, this is the worst end of the manifestation. And I'm going to give you a mantra today, which you probably already know, which is my body is my temple. How do you treat your temple? Right? How do you treat it? In La Jolla, I can't tell them about their body being their temple. I say, if you have a Rolls Royce, what kind of gas do you put in? The cheapest stuff? Or do you put the best stuff in there? Right? Oh, I put the best stuff. Then why are you not treating your body that way? So this is epigenetics at its worst. This is epigenetics at its best. This study looked at the Amish community. And they said, gee, these guys are all carrying the gene for obesity. Scratch their head. Why aren't they obese? Any ideas? Lifestyle. So what did the researchers conclude at the end? They said they're walking 18,000 steps a day trumps the obesity gene. Has anyone here walked 18,000 steps a day? Everyone have a Fitbit or a pedometer or something that's tracking what we're doing? Right? Will you be surprised how little we're moving when we start to do that? So their 18,000 steps a day and their lifestyle trumps the obesity gene. This is Dean Ornish's work. Dean said, let's take guys with stage Gleason 6 prostate cancer. When a guy has Gleason 6 prostate cancer, they hear words like this, let's do watchful waiting. Has anyone ever heard that? What are you waiting for? My cancer? What are we waiting for? Can I do something? So Dean said, let's do something. Let's teach these guys yoga, meditation. Let's put them on a vegan diet. Let's put them in support groups so they can get their emotional stuff and feel connected to community and people. And let's see what happens to their epigenome. Remember, turning genes on and off. And this is what he found. Each of these lines represents an individual. The red are the cancer genes that are turned on. 6 months later, take a look at this. Over 350 cancer genes turned off through lifestyle. So don't let anyone ever tell you that you can't change your body, your physical body, by the things that you do, because you definitely can. And what you'll notice about this approach is it was a body, mind, spirit approach. It wasn't just, I'll eat the vegan diet and I'll be pissed off and yelling at everybody, right? It was and we did this with heart patients in the 90s, and I participated in all that research. But learning yoga and meditation or Tai Chi, something that helps you when life throws you that curveball, looking at what's important in your life through the support groups, setting your priorities, what is my purpose in life, and so on. This was a true holistic approach. So Albert Einstein said, intellectuals solve problems, geniuses prevent them. I thought, well, if it's good enough for Einstein, it's good enough for me. I'm solving problems by putting in stents. How do I shift my focus to preventing disease in the first place? What are the tools we have in our toolbox? So I began to think about it this way. And I did a whole course, and this is not as a promotion. I did a whole course for great courses called The Science of Natural Healing. And I thought, what is the best analogy I can use? And I thought, went back to my old IFM training, and I said, a tree. Because if I have a tree in my backyard, or if you have a tree in your backyard, and your tree has a sick fruit, let's put a sick fruit here and a sick fruit here. What are you going to do for your tree? Somebody tell me. You have a sick fruit. What are you going to do? You're going to prune it. She's a surgeon, right? You're going to go up and you're going to cut the branch off. What else might you do for your sick fruit? Your sick tree? Fertilize it, nourish it. All right, so who's going to give it Miracle Grow or something like that? Who's going to see if it needs sunlight or water, right? So you're going to go into the soil. So in Western medicine, we take the sick fruit. We say, oh, diabetes, here's your metformin. I'm not against drugs. I use a lot of drugs. But I would stop there. Take the metformin, see me in 3 months. Here's your metformin. Oh, you have depression, here's your antidepressant. You have high blood pressure, here's your high blood pressure. Now what we say is, and this is what I teach my patients, when a doctor says to you, or a nurse, or any healthcare provider, gives you a label, they name it and they blame it, you're going to say, why? Why do I have high blood pressure? Why do I have diabetes? Right? Why do I have arthritis? Because that takes us into the soil. So if that fruit is labeled diabetes, we're going to say, let's look at what you're eating. What kind of carbs and sugar are you eating? Let's look at your micronutrients. Do you need magnesium and chromium? Let's see if you're physically active, or are you sitting behind the desk eating potato chips? Are you sleeping at night? Sleep disturbance raises cortisol. Sleep apnea raises cortisol, puts weight on us. Are you exposed to toxins? We now know that persistent organic pollutants, POPs we call them, are associated with diabetes. Where are you at emotionally, mentally, spiritually? Are you a hothead that every time something happens you blow a fuse which raises your blood pressure and your cortisol stays up all the time? Or are you someone who responds differently to stress and tension? And where are you at with your relationships, your community, your relationship to a higher power, your relationship to nature? Who are you? So I'll give you a perfect example. A gentleman came in to see me, and I was the third cardiologist he saw. He was on 3 blood pressure medicines. They wanted to put him on a 4th. He came in, he had a stack of records this big. He had every test you can think of for blood pressure for the nurses in the room and healthcare providers. They did urine for metanephrines, for pheochromocytoma. They looked at his kidneys for renal artery stenosis. They said, there's no reason for your high blood pressure. Here's your 4th pill. I said, tell me what you do when you get up in the morning. I want to go through your whole day. And this is no exaggeration. He said, I drink a Gatorade. Oh, Gatorade. What's in Gatorade? Sodium. It's great if you're dehydrated. How many of those do you drink a day? 15. Consult over. Stop the Gatorade. Monitor your blood pressure. Get on a less than 1,500 milligram sodium diet. Went from 3 medicines down to none. No one asked a question. Why is his blood pressure high? You guys with me on this? Right. So somebody comes in with arthritis. The question is why? Is it too much sugar in the diet? Yes, I'm sorry to say sugar causes arthritis. Do you have a sensitivity to dairy? We always think of dairy as causing gas and bloating, right? When you can't tolerate it, guess what? It can also cause arthritis if you're sensitive to it. Do you have a sensitivity to wheat and gluten? Right? Is there something that's leading to the inflammation causing the arthritis? So that's how we think. So I began to shift my thinking from stents as an intervention to lifestyle as an intervention. And the first question we got to ask is, what should I be eating? Because food is not only medicine, it's information. It's sending signals to your genes. Now, we talk a lot about weapons of mass destruction. And I, of course, picked the ones that I was raised on. I was raised on this. My grandma would give me, anyone else raised on Wonder Bread? I had Wonder Bread, nice and soft. You can roll it into a little ball, totally processed. They took everything out of it, so they had to enrich it with something, right? That's how those words come about. If I was good, I got soda. I had a cake every night, and every morning I had Frosted Flakes. I was on a sugar high, right? No surprise. So when we look at this kind of food, it's high in sugar. There's no nutrients. There's no fiber. It's oxidized. It's trans fats. It's chemicals. Does anyone have kids here? Now, we're all guilty of taking them to those fast food burger joints because they cry until we take them. Even I'm guilty of it. Anyone ever find these French fries stuck in the back of the car seat 6 months later and they still look the same? Oh, you can't make it up, right? It's real. So the bottom line is we are overfed and undernourished. Let me say it again. Overfed. You can be overfed. You can fill up really quickly without a single nutrient in your body. And if there's one message I can get to you today is let's get rid of this stuff. And let's start filling our body with phytonutrients. And we'll talk about what those are. And foods that actually have a purpose. And even if you say to me, I don't like that, I guarantee you, once you start, you will change your taste buds. And you just have to have some resiliency. You have to have some persistence, right? And be gentle with yourself. But you will absolutely feel 1,000,000 times better. So in 1894, this was a Coke, 79 calories. Look at it today, 250 calories. So we supersized everything. We not only took something that wasn't good for us, but we mass-produced it. And I don't even know how many calories right now, depending on the size of your big gulp, right? And this is, of course, and you may know this, that soda leaches calcium from your bone and also causes osteoporosis. So for those of you who have that soda addiction, time to start saying, I'm cutting it 50%. Right? And then in a couple of weeks, you say, I'm cutting it again. And before you know it, you'll be off it. This says, hi, I'm Coagula, the goddess of arterial plaque. Yes? Yes, she is. I like this one from the 50s. They're happy because they eat hard. But they're skinny. You notice? They're skinny when you look back at those old TV shows. And they're people that are actually a lot thinner than we are today. But they're happy, and that's good. Then we have major medical journals. This is one that says 7-Up flushes out cholesterol. 1 can a day adds years to your life. And if you eat that fried chicken diet, you get to look like Dolly Parton. So lots of information, lots of bad information. Should I be on this diet? I'm going to go on that diet. I'm going to do this diet. We're just going to go to the basics today. Let's start with the Mediterranean diet, right? I'm going to eat foods that are filled with greens, green leafy vegetables. I'm going to knock out these white potatoes and the white bread. I'm going to talk to you about a modified vegetarian diet, Mediterranean diet. Fish, some poultry, right? Look at this, 4 ounces of alcohol, not 2 bottles of alcohol. Well, what has the Mediterranean diet been shown to do? 72% risk reduction in cardiovascular events, 80% risk reduction in late cancers. So when you're looking at your plate or your table, I want you to say no liquid calories. What's a liquid calorie? I saw it out there this morning. Fruit juice. All right, give me another one. Soda, pop, right? And then alcohol. Yeah, you can have a small amount of alcohol every now and again, but remember, it's sugar, right? So 72% risk reduction with a Mediterranean diet. The American Medical Association Journal said this: evidence indicates that diets using non-hydrogenated fats, whole grains, remember whole grain is not whole wheat. You can roll your bread into a little ball and toss it. That's what I want you to do with it. A whole grain bread, you cannot roll into a little ball. So whole grains as your carb. The carbs I recommend to my patients are basically quinoa. Anyone here like quinoa? All right. Small amounts of brown rice if you like it, but remember, it's high in carbohydrates. So if you want to lose weight, you might want to say, gee, I'm going all greens. I'm going to get my broccoli and my kale and my cauliflower and all of that. But complex carbs, fruits and vegetables, and omega-3s protect against heart disease. So if the American Medical Association says this, why are my patients getting a roast beef and mayo sandwich? All right, why are my diabetics getting a big scoop of mashed potatoes? Doesn't make sense. This was a very nice study called the HALE study, which came out of Europe, looking at people to 70, 90 years old. And it's a message. We're never too old to change, right? And to feel better. And what they found was adherence to a Mediterranean diet was associated with a 50% lower rate of all-cause and cause-specific mortality. What did they study in this program? Very simple. Mediterranean diet, walking every day, not smoking, and small amounts of alcohol, right? Look at these numbers. This is from the HALE study again. 64% of deaths from coronary disease prevented, 61% from all of cardiovascular disease, 60% from cancer. Okay? So I don't want you to think of the Mediterranean diet this way. You could distort any diet in the world, right? So you could say, I'm vegetarian. And I see a lot of overweight vegetarians. Tell me what they're eating. Yeah, French fries. They're eating sandwiches filled with big tons of cheese and mayo and avocado. And then you take your Mediterranean diet and people say, oh, bread and cheese, that's the Mediterranean diet. No, you can distort any diet, and you have to be honest with yourself. So the true Mediterranean diet should be low glycemic, which we'll come to in a minute. And I'm going to have all my green leafy vegetables. I'm going to eat from the rainbow. I'm going to not have the simple carbs, the bread and the pasta and the potatoes. Right? I'm going to do lentils and beans and legumes in place of those. And I'm going to have my fish. That's a real Mediterranean diet. This low glycemic Mediterranean diet did better than the American Diabetic Association diet in improving blood sugar. No surprise. We keep wanting to cut corners. And if we just say, you know, I'm going to just change the way I approach things. In the morning, I'll have steel-cut oats, if I have to have some oats. Or I'll make myself a nice omelet that has healthy things like greens in it. Or I'll make myself a protein smoothie or a green drink. Right? I'm not going to have bacon and, you know, bagels with cream cheese and so on. It's all doable. So we think of food as medicine, and we say, what are functional foods? Well, these are foods that contain lots of fiber, legumes and vegetables. I'll walk you through the fruit list in a second. Real steel-cut oats, barley, and again, for those people that say, gee, I might want to take off some weight, do your carbs, your steel-cut oats if you like them in the morning, a little bit of quinoa, but we want you to focus on the green leafies. And what are the green leafies? arugula and bok choy and Brussels sprouts and cabbage and kale. There's got to be, I gave this list to a gentleman. I said, circle what you like. You know what he circled? It blew me away. Watercress. I said, who eats watercress? And I guess the list was just slight. Oh, no, there it is. And he circled radishes. I said, good, that's your snack. Radishes in a Ziploc bag. All right, there's got to be something. Broccoli contains sulforaphane, phytonutrient, which protects against cancer. So broccoli is what we call a functional or medicinal food. Green leafy vegetables, the same. Cabbage, Brussels sprouts, broccoli, cauliflower, spinach, reduce the risk of diabetes 14%. Just adding a simple serving. What's in this that lowers blood sugar? Does anyone know? What's in these things? Fiber. All right? So if you decide to drink fruit juice, you drink that liquid juice, it goes right into your bloodstream, your insulin level goes up because now you have a high blood sugar, and your blood sugar gets knocked down, you say, oh, I'm exhausted, right? That's called sugar blues. But when you eat the whole apple is filled with fiber. So it sends the blood sugar into the bloodstream at a much more gradual pace, doesn't raise up your insulin, and doesn't knock you back down. Does this make sense? Right. So foods that are filled with fiber lower cholesterol, fill us up, and lower blood sugar. Mushrooms are also immune boosting, shiitakes, matakes, and nakis. What I don't want you to do is get those white button mushrooms and put those on your salad because those are usually can be filled with toxins. So mushrooms really should be cooked and not deep fried, right, for their benefit. Stir fry is good. Berries, the darker the green, the better they are for you. Right? Ideally, they are organic because they're very thin-skinned, and if they're sprayed with a lot of pesticides, you'll get exposed to that. So I'll show you how we pick our organic fruits and vegetables in a minute. But blueberries are low in sugar. All berries are. They're low on what we call the glycemic index. And all of this information you can get off my websites, which I'll show you at the end, so don't feel like you have to take tons of notes. But they are potent antioxidants, good for your eyes, prevent urinary tract infections. These are functional foods. Nuts. Who likes nuts here? Do you guys have Costco in this town? That's good. Because everything there is supersized, right? The muffins are 1,300 calories, and the nuts come in containers this big, and people just eat through the whole thing. Nuts are good for you. They contain magnesium, manganese, copper, zinc, and calcium. They're a monosaturated fat, a small amount, right? 10 nuts. Nuts as a garnish, not nuts. Otherwise, they're so calorie dense. They have a lot of calories. Like olive oil has a ton of calories. So we use small amounts of the good fats like nuts and avocado and oils. Small amounts. Well, we got to go to this one. So should I buy my food organic or not organic? And the question becomes, what foods are sprayed a lot? And what are they exposed to? Well, the rule goes like this. There are a lot of pesticides and herbicides being used. There is some genetic modification of seeds. We'll talk about antibiotics and hormones in a minute. And hopefully, if we buy organic produce, we're not getting that. Do you have the little numbers on your fruit here when you go to the store, right? And we say 9 is divine, which means the 9 is an organic. That's how you identify something that's made organic if it doesn't say it. So there's an important website called the Environmental Working Group. And if you go to that website, EWG, you can download up-to-date information about what kind of pesticides am I getting from my foods, what should I buy organic, and what should I not. So they have something called the Dirty Dozen. The dirty dozen, we have to buy organic. Celery, nectarine, berries, kale, cherry tomatoes, spinach, summer squash, potatoes. This was one of the lists. It does change every now and again. The clean 15 we can save our money on. We don't have to buy onions and avocado and pineapple and cantaloupe. Notice these have thick skins, a lot of them. Eggplant, grapefruit, mango. So take a look at the Environmental Working Group website. Download a list of the clean 15 and the dirty dozen. It's up to date. The 2014 list is on there. And then you can just take that with you to the supermarket. And better yet, if you can, grow your own. We just don't have to grow marijuana. We can grow fruits and vegetables. Right? What about fish? Who eats fish here? Right? Do we get wild fish? Do we get farm-raised fish? I'm going to vote for getting fish out of our lakes that's wild, whether it's wild trout, wild salmon. Research shows if you compare, for example, farm-raised salmon to wild salmon, 13 more high levels of toxins were found in the farm-raised product. You have to, this is not pleasant, but you have to ask the question, if I eat an animal, what did the animal eat? All right? What did this animal eat? Because that's ultimately what I'm eating. So if the animal was given grain instead of grass to graze on, I'm getting omega-6 grain that leads to inflammation. If the animal's given antibiotics, guess what I'm getting? All right, if the animal is giving steroids or hormones, guess what I'm getting? So you have to ask that question, what did the animal eat? Now, Gandhi said this, the greatness of a nation and its moral progress can be judged by the way its animals are treated. I, for one, believe if you're going to eat an animal, it should be grazing on grass, not in a feedlot. These are chickens, right? This is not a chicken that's free range, running around, and so on. This is mass production of food. These animals, to stay in these tiny cages and not get each other sick because they're peeing and pooping on each other, are given antibiotics prophylactically. They don't need it. And this has been proven that this is one of the reasons we see so much antibiotic resistance, right? Because it's being passed on to us. So this is a cow on what's called a KFOS, very different from the cows grazing in our beautiful green pastures. I don't have any clue of what they're giving them in this feed, but I can tell you they're being given hormones, they're being given antibiotics, and they're being fed corn, again, which is high, grain, which is high in omega-6. So what did the animal eat? In the United States, 71% of our antibiotics go to livestock. Right? Why does it make a difference? It's going to make a huge difference in the planet, because the gold on this planet right now is not what we think of as gold, it's water. All right? And we're going to face the question of what kind of foods lead to consumption of resources. And this is happening already. And if you look at agricultural use and energy consumption, and this is looking at diet, Mediterranean diet versus an animal-based diet, when you start taking food from the earth, you consume much less resources. And you have much lower greenhouse gas emissions. 51% of the emissions is coming, I'm sorry to say, from agricultural industry. So we're going to have to start making some hard choices, and we can make these choices ourselves. And I'm really happy when I see hospital systems saying, hey, it's going to be meatless Mondays. Or as I grew up in the Catholic tradition, we had meatless Fridays, right? So we're going to have to start looking at this, not only from our own health, but we have to pass this planet on to the next 7 generations, 10 generations, God willing, 20 generations. And what are we handing our kids and our grandkids and our great-grandkids? What kind of air, what kind of water, what kind of food supply? And these are very deep questions. And they plague me more than worrying about people getting heart disease, which I worry about. But we have some global issues to address. So if you decide you're going to listen to a little bit of this and you're going to say, okay, I'm having green leafy vegetables, I'm having salad with my wild salmon, I'm going to have a meatless meal. I'm going to put beans and lentils, lentil soup, kale salad. I'm going to get really into this. And then I'm going to do some sort of physical activity. Because this is what happens. A lot of people come to see me and they say, hey, Dr. G, I want to get this weight off. I put them on this great diet, and then they come back and they say, or nutrition program, I should say, and they say, I hit a plateau, can't lose another pound. Has anyone ever experienced that? Right? We can be honest with it. It's okay. I say, how much are you exercising? Head goes down. This is what happens. You can take two people. They can get on the scale, and they can be the same exact weight. The scale is not really that helpful. What's important is body composition, because if this gal says, I'm going to eat the green leafy vegetables, I'm going to eat the low-sugar fruits, I'm going to make my protein smoothie in the morning, and I'm going to resist the bread and the cookies and the cakes and the ice cream and the French fries, she's going to put on muscle mass because she's exercising. She could weigh the same, but guess what? She lost her muscle mass. That's what she lost, muscle. She didn't lose fat. This is why when we talk about fitness, it has to go hand in hand with the nutrition program. Now, we know something that I didn't learn in medical school. There's something called skinny fat. Has anyone heard this expression? You can be skinny, but you could be all fat. Right? You have no muscle. And how do we know this? We know this by doing a body composition. So this is why we want you to exercise. A beautiful study looked at what happens if we take pre-diabetics and we give them a placebo, a medication called metformin, or we teach them to exercise and eat a low glycemic diet, a diet that doesn't spike up the blood sugar. What they found was at 4 years, those people who were exercising and eating right were the least likely to develop diabetes. Right? Again, how do I take the first step toward preventing a disease? We also know this. We know that exercise decreases inflammation. Remember I said inflammation leads to Alzheimer's disease, dementia, heart disease, arthritis. All those itises, like tonsillitis, that's inflammation. Osteoarthritis, that's inflammation. So if we can turn off the inflammation, we can turn off a host of problems. And so this study showed that the inflammation marker goes down with exercise. And furthermore, something called brain-derived neurotrophic factor goes up with exercise. The higher our brain-derived neurotrophic factor, the less depression we have. So when someone comes to me and they say, I feel depressed, the first thing I say is, we're going to get you outside doing something physical. We're going to get you to do something you like, whether it's a Zumba class or a personal trainer, because I want to increase the brain-derived neurotrophic factor. We know that if you exercise and decrease your weight, for every kilogram of weight you decrease, you drop your systolic, or the top number of your blood pressure, 1.6 millimeters of mercury. So if you were to drop 5 kilograms of weight, which is about 10 pounds, you would not need a second blood pressure medication. And when I show this to my patients, they get it. They go, all right, I get it. That's how we stay off the drugs, or that's how we don't have to escalate the drugs. So we recommend exercising every day, aerobic at least 40 minutes to 1 hour, and then strength training 3 times a week. People say to me, I was told I should exercise 3 times a week. And I say, do you eat 3 times a week? If you're on some sort of detox fast, then yes, you shouldn't do strenuous exercise. But if you're eating every day, you should be moving every day. And years ago, what kind of exercise did we do? We chased animals, right? We worked in the fields. Women, I can remember my mom carrying a basket of laundry up 3 flights of steps to put clothes on the line. We didn't have a clothes dryer. That was exercise. She didn't have to go to Family Fitness. Right? Now I'm not against everything being automated. That's all great, but what it's done is it's left us sedentary. And so we stopped doing those things that were practical. Instead of mowing the lawn, we made it electric. Right? So just start paying attention and saying, well, I could park the car further. I don't have to take the elevator. I can go up the steps. Right? So you don't always have to have it be at a fitness center. You just have to look at your life. How much time am I spending in front of the screens? The little screens, the bigger screens, and then the TV screens. Most of America is in front of a screen for most of the day. So how do we start to say, turning off the screen? Who goes to sleep with their cell phone next to their bed? Who looks at their emails right before they go to sleep? No, this isn't bad. Usually the hands go up. So I'm telling everyone, I'm on a little thing where I'm saying, you know what? Take a day a week where you take, call it a Sabbath, where you say, I'm done with the computer, the email. The people that need you, they're going to find you. Right? Your family's going to find you. But I love when I get an email and someone says to me, I emailed you 5 minutes ago. You didn't respond. Are you for real? We've set this whole new set of expectations. So this is exercise in San Diego. I'm going to go up the escalator to the fitness center. I'm sure these guys took the closest parking spot, probably had grandma's handicap sticker. So, you know, I am such a firm believer in lifestyle change that I thought I would bring a couple of my patients to sort of summarize this whole piece about nutrition and exercise. And so I decided to bring them in video form. So here you go. You could turn that up a little.
Get your motion ready. Head out on a treadmill.
The heating pad is warming in case you're herniated disc kills.
We're aging boomers but refuse to show it.
I just had implants and a tummy tuck.
A triple bypass and 2 knee replacements. Getting overly sounds. I just took Viagra. Both the kids are our age.
I'll go get some Merlot. Let's hope it won't inflame your prostate.
We're baby boomers, the original rebels. Used to smoke pot, but now we drink green tea. We tripped on acid, now we have acid reflux. We're in the AARP. We were spoiled, pushy, wild, but now we're bored, tubby and mild. We used to get so high, now they call us dry. Bored, tubby, mild. Bored, tubby, mild. Boy, I'm exhausted.
Is it your heart? Are you having chest pains? Have you been taking your Plavix? Let me call the doctor. You sit there. I'll be right back. You just stay there.
Well, so there you have it. I think my favorite line is, we used to smoke pot, now we drink green tea. That says it all. So the next frequent question I get when we talk about health is people come to me and say, hey, give me some supplements. And I say, guess what? A supplement is just that, a supplement to a healthy lifestyle. And I see a lot of doctors doing this now. They say, oh, don't take your statin, take reduced rice, right? Instead of teaching people how to eat and getting to the underlying cause of what's going on. So supplements are great, but they have to be used in the right way to supplement what we're doing with our lifestyle. And I'm going to give you an example through one of my patients. This is Ron. Ron came to me after his bypass and his device, his defibrillator, so he could be shocked if he has another episode of sudden death. He had multiple stents, and he came to me with all the things you can imagine that are related to his weight, quite frankly. He had diabetes, he had muscle loss, he had sleep apnea, right? He had gout, he had fatty liver from his diabetes. That's all fatty liver is I have fat in my liver. He had osteoporosis. Fortunately, he did not have cognitive decline. He did not have polycystic ovary syndrome. And he had high blood pressure and cholesterol abnormalities. So of the medical people in the room, who recognizes this patient? all right, every day in our practice. Okay? So Ron came to me and he said, I had this bypass, I'm terrified, I want to get off the tracks, I never want to go through that again. I said, good for you. What do I have to do? And I'll show you the end result of Ron. Hopefully I have him at the end of the slide, but you know, I put him through all the nutrition things he had to do. I got him exercising, and then the question became, well, how do I approach the supplement world? And I thought I'd use Ron as an example of how we should be thinking. So let's just take Ron's triglycerides. Triglycerides are the form of fat that come from sugar and carb. So normal is less than 100. Ron was 585. He was also diabetic. His hemoglobin A1C, which should be less than 5.7, was 6.9. Let's just take those two things. So if somebody's triglycerides are high, I'm going to say the first thing you have to do is go on a low glycemic diet. Apples, berries, peach, pear, plum. I don't want you on the high sugar fruits. I don't want you on watermelon, dates, and raisins. Right? And you can get these handouts. You guys are familiar with glycemic index? Okay. So I want to keep you off the cookies, cakes, candy, ice cream, the French fries, or the liquid calories, all the things we were talking about. So I give him food guidelines to follow. And then he's got his exercise guidelines. And then we say, okay, so what supplements am I going to give him, or what drugs am I going to give him? And when I think about triglycerides, I'm going to go back to the Hippocratic Oath and say, first do no harm. And I'm going to jump to omega-3 fatty acids, which is fish oil, omega-3. And why am I going to do that? Because the research shows 4 grams of fish oil will decrease his triglycerides 45%. So in addition to his nutrition, in addition to the fitness burning up his sugar and his triglycerides, I'm going to hand select this supplement for him. I may also use niacin, because niacin in men raises HDL, the happy or good cholesterol. For every point we raise this in men, for every 1 milligram, we decrease risk by 2%. So I'm going to do that as well with Ron. And we know that as I raise his good cholesterol, I pull more plaque out of his vessel. So now I'm thinking about this B vitamin called niacin. And then I'm thinking about anti-inflammatory agents. Because Ron has cardiovascular disease, he has heart disease, he has diabetes, he's inflamed. The first way to turn off the faucet and to put out the fire is to say, I'm going to deal with the inflammation. And that starts with the food, of course. And then we're going to look at supplements like turmeric, which I'll show you in a second, and ginger, and cayenne, and green tea. Now, I'm not saying everybody should take all of these. But when I start talking to him about spices, his spice is no longer going to be sugar. All right? His spice is going to be turmeric and ginger. And he's going to drink green tea instead of drinking pop. So this is one of the research studies that justifies that. This study looked at curcumin, turmeric, 500 milligrams twice a day, baseline in 9 months, showing marked reductions in blood sugar and the 3-month blood sugar hemoglobin A1C. So I like to take this supplement world and say, let's apply the evidence and personalize it to the individual, right? So Ron also has coronary disease, he has calcification in his arteries, so I'm going to put him on aged garlic extract. I may put him on K2, which is a vitamin K. Why? Because those have been shown to block calcification of arteries. So tailoring his supplement regimen to meet his needs. This was a study that came out in 2010 that says what happens if we give probiotics to individuals, L. acidophilus, for 4 weeks. It improves insulin sensitivity. Changing the microbiome impacts the diabetes. So he's getting a probiotic. What about magnesium? Insulin resistance decreases. This is from the Diabetes Care Journal. So guess what he's getting? Magnesium. And also magnesium prevents arrhythmias. The only side effect of magnesium is soft stool. So my patients tend to love it because everyone is constipated. So I can give everyone lots of fiber, lots of magnesium. The only time you can't take magnesium is if you have kidney problems. So it's good to know. So I give Ron magnesium because it improves how the sugar, his insulin, and improves the sugar into the cell. It decreases his inflammation, right? The lower your magnesium, the more inflammation you have, the higher, when you supplement, you improve that. So again, I'm hand-picking what he's going to get based on what he needs. He has a history of heart failure, so he's going to get CoQ10. This study called Q-Symbio that came out in 2013 showed people with heart failure, CoQ10, improvements in mortality, improvements in hospitalizations, significant reductions in cardiovascular events. So now we have to say, all right, I have my botanicals, I have my nutrition, I have my fitness, I've personalized it for this gentleman. So we say imbalances determine treatment, and the supplements we recommend are tailored to the individual. Again, someone says to me, I have osteoporosis, Dr. Guarneri spoke to a woman yesterday, I don't want to take any pharmaceutical therapy. I said, okay, it's mainly in your lumbar spine. We're going to put a weight vest on you. We're going to do strength training. We're going to put you on K2 and good calcium. We're going to get your vitamin D level up, give you magnesium, and so on. We're going to do everything we can do to strengthen your bones. And then we're going to check you to make sure we're heading in the right direction. So that's how I want you to think about the supplement world. You can't eat, drink, and be merry and say, I'm just going to take 50 supplements a day. You have to really think about, how do I get back to basics? So my next session for this group is on stress. So I'm not going to spend a lot of time on the mind-body connection talking about this, but I've learned over the course of the years that this is single-handedly what's driving the train. Because when I look at my practice and I see all of the things that people do, what do? We overeat. Why do we overeat? Oh, I was so stressed out, right? Why do you drink at night? Half a bottle or 2 bottles of wine. I was so stressed at work, I came home and had a few drinks. Frequently, maladaptive behaviors come from our need to deal with our stress. So the question becomes, how can we transform the way we respond to stress so it's not with food, with alcohol? And I had this great experience where I was at the airport and I was buying something at one of the counters. And this woman in front of me, who probably had about 100 pounds to lose, had all of these chocolate chip cookies. And one of my first lessons in life is never to be judgmental, because you never know where someone is coming from, right? Or what's happened in their lives, what their journey has been. But I thought to myself, I wish I could reach out to her and, say, maybe that's not the best thing for you. That's my medical mind interfering in people's business. And as I'm going through this little thing, she turns to me and looks me straight in the eye, and she says, I had a really bad day. I deserve these cookies. It was almost like she read my mind. It was amazing. I thought, you should be a psychic. So, but frequently, all of our stress leads us to all of these addictive behaviors. And no doctor wants to talk about them. And they go like this: shopping addiction. I have patients who have shopping addiction. I have patients who have sex addiction. I have patients who have gambling addiction. I have patients, now we have 12-step programs for video game addiction. Do you know that? So it's not just food and alcohol and cigarettes. There's all sorts of things that people use to get to their path for inner peace. And we need, and what we'll talk about in the next session, for those that come to that session, is how do I find a different path for my inner peace? So Hans Selye said, stress can be defined as a state one experiences when there is a mismatch between perceived demands and our perceived ability to cope. Right? There's a mismatch. A lot of times when we keep, anyone in here say yes to everything? Don't want to offend anyone, want to be nice, right? We keep adding things onto our plate. And if we can get the job done, it's a challenge. Oh, we have to put this conference together. I'm sure Katie and Mary, Rhonda, everybody, Peggy, this was a challenge, but you knew you were going to get it done, right? Maybe you had a little stress once in a while. But there's a difference between stress and challenge. So our perceived ability to cope. This has been around a long time. This is from a medical textbook from 1881. They called it American nervousness. And they said the primary cause is a rapid increase in nervousness in modern civilization, which is distinguished from the ancient by 5 characteristics: steam power, periodic press, telegraph, sciences, and the mental activity of women. And notice this audience is mainly female, right? That's what was causing American nervousness. All right. Well, I got this slide from a friend of mine, Lee Lipsenthal, who got it from his friend, and the story went like this. Honey, the kids are quiet. Go and check on them. Well, look at this little guy. Yeah, and the bottom line is, life gives us curveballs. It's how we respond to them, right? All day long I hear people say, my husband does this to me. My wife does that. My kids cause my stress, right? We're all guilty of saying things like this, and the reality is it's our response. This couple was astute enough to say, get the camera. So when we have our foot on the gas pedal and we're pumping our adrenaline and we're releasing our stress hormones, which are there for the fight-flight reaction, they're not there for everyday life, we do this to our body. We make our blood sticky, our platelets coagulate, we raise our blood pressure, we put weight on in our midline. Yes, I've seen many people doing their exercise, doing their diet, and their nutrition program, and they hit that plateau, and it's all related to stress, because when we're under stress, our cortisol is high, and we gain midline weight. We become diabetic from stress. Our cholesterol goes up from stress, and this one everyone knows. When you get anxious, if you have to get up and publicly speak, and you don't like to do that, what do you notice about your heart? Right, it starts to race. It's what we call tachycardia. So as a cardiologist in the 90s, I looked at this and I said, wow, this is really cool. I give aspirin to block this. I give ACE inhibitors or blood pressure medicines to block this. I give metformin for this. I give cholesterol statin meds for this. Beta blockers for this. High blood pressure calcium blockers. And I realized all the cardiac meds I was giving were impacting the stress hormones. So I thought, oh, maybe we should medicate and meditate, right? Maybe we need to think about this differently. So when our cortisol is high, we have accelerated aging. Take a look at some of our presidents, past presidents and president today, right? They don't look like the same person 4 years later. We have brain cell death, impaired memory and learning. We lose our bone density. We develop osteoporosis. Now, look at what's happening. We call this aging. We say, oh, you're getting old. I can't remember anything. I have osteoporosis. I don't have muscle mass. My skin is hanging a little. I'm diabetic, and I'm heavier than when I was younger. And all of this is being driven by cortisol. Who goes to a yoga class here? Anyone? Right? What does your yoga instructor look like? You are. And you're 100 years old, right? What has always struck me about all my yoga instructors is they're like 70, 80, and they all look like they're 50. No, I'm serious. And because they're living a different kind of life. Yes, they're eating vegetarian, a lot of them. But they're doing yoga every day, they're meditating every day, and they're keeping this under control, this hormone called cortisol, right? So when we think of all the elements that go into aging, if we don't factor in how we respond to stress and tension, we're missing a big piece of the puzzle. So how do we turn stress into strength? Well, lots of options. Many of my patients like to exercise, particularly in nature. For many people, connecting to nature, right, is a real way to renew. So getting out and exercising, learning breathing exercises, practicing appreciation, right? Some of us have a half full glass and some of us have a half empty glass, right? You know who you are. If you're the kind of person that walks in this room and goes, oh, look at all these people. I'll never get a seat. Or are you the kind of person that walks in the room and goes, wow, look at all these people. Everyone in Evansville is into getting healthy. This is great, right? So what lens do you see the world through? So that's where practicing appreciation comes in. Because I had a woman come in and say to me one day, I want to know, do I get my omega-3, my fish oil, from a salmon that is 50 feet down in the water, or a cold water, or a white salmon, or a pink salmon? And she was going on and on about this salmon. And I said, you are going to stress yourself to death worrying about where the salmon came from, right? So sometimes we have to put things into perspective, right? What is really important? And that's where the appreciation piece comes in, because if we wake up every morning and we say, thank you, God, I've got another day. I got out of bed on my own 2 legs, right? I get to use the restroom because I could still urinate. I'm not on dialysis, right? I have 2 healthy grandkids. These are the things in life we take for granted. And we focus on the drain that's clogged, right? Or we focus on the fact that the neighbor's rose bush is coming into our yard. You know what I'm talking about, right? And only we can stop this thinking. Only we can say, okay, ridiculous, get out of there, move on to what's important. The only thing I think good about the news in this country is it makes us realize what's important. Because otherwise it's just a source of huge stress in many, many ways. But when you look at what's going on in the world, you say, my God, I'm so grateful I was born here. Right? Thank God I'm in this country. And how many blessings I have. So how do we get people to practice appreciation? Stop making assumptions. You know, we tend to think we know things about people. We look at them and we all of a sudden know the whole story of their life. Has anyone ever done this? You see someone in the airport and you think you know their whole story. And I do some exercises. I used to do these in the heart program with my patients. And I always had one little exercise where I'd say, okay, so you going into a shopping area and you park your car and you open your door to get out and a man pulls in next to you and opens his door and knocks you over. How do you feel? What do you think they say to me? Mad, angry, pissed off. I'm pissed off. And then I say, then you see him running into the pharmacy and his baby's having a seizure and he's going to get the medicine. How do you feel? So don't assume you know everyone's story. You know the old saying, until you walked in someone's moccasins? Right? We're all great at making up stories. And so this concept of assumptions, the other thing I had to learn around this is don't take everything personally. Right? It's not always about you. They didn't turn off the lights just to piss you off. Right? To make it hard for you to see. Right? So it's not always about us. And there's a great book called The 4 Agreements. Has anyone read this book? It's a great book. And one of the keys to the 4 Agreements is to be impeccable with your word. Right? Say what you mean what you say. And the less we say for all of us, the better off we probably are, right? And to not take things personally. The minute we start taking it personally, it really makes us sick. It doesn't make anybody else sick. It makes us sick if we get upset by it. So getting plenty of sleep is in there. Caffeine's an interesting one. The question I have there for everyone is, when you drink caffeine, does it shorten your fuse? Are you more likely to fly off the handle? Are you more likely to yell at someone? Or does it not bother you, right? So that depends on your metabolism. Communication is important. In my office, I have the Serenity Prayer. Is anyone familiar with this? It's right on the wall in my office. I have 2 things on the wall in my office. One is do unto others as you would have them do unto you, and the other is the Serenity Prayer. And the reason I have that there is people just go on and on and on and on with things they can't control. And I say, okay, time to do the Serenity Prayer. What can I control? What can I control? Right? Your teenager comes home with a girlfriend or boyfriend you don't like, you can make it difficult for them, but that's the time for the serenity prayer. So there's a time for it. Social support. Who is my tribe? How am I connected? And the concept of perception, which we'll look at. So stress, Mark Twain put this way: I have suffered a great many misfortunes, most of which never happened. Right? Who are the worriers in the room? Oh my God. What do we solve, just checking on time here, what do we solve by worrying? Absolutely nothing. And who do we get sick by being angry at someone? Us. Right. Whose blood pressure goes up when we're angry? Mine. Whose coronaries constrict? Mine. Whose blood sugar goes up? Mine. Right? So anger is like, eating the rat poison and expecting the rat to die, but the rat is still walking around. Right? It just doesn't work that way. So I want you to think about it this way. This guy's a perfect example. Wall Street collapse. Test faith and new economy. Look at his face. Well, I think he's not doing the "this too shall pass" prayer. So the key is initiating events occur. Life happens. None of us are on a free ride. We all have losses in our lives. Life goes like this. It's like day and night, right? So there are initiating events. What is our response to the event? His response, doom and gloom. Some other guy may be saying, everything's falling, let's buy, right? What is the response? What is the perception? It's the end of the world. I'll never survive it. Or a great economy is going to come out of this. What lens do you see through? Because ultimately, that's what has the effect on the physical body. That's what drives the stress response. It's not the initiating event. It's not that the kids are standing there covered in paint. It's how you respond to it. Do you laugh at it? Or do you blow a gasket and raise your blood pressure to 240? So I'd like to do a little experiment on perception with the group, if you're up for it. You up for it? Very short. We're going to divide the room right where the natural divider is. And you haven't shown this to them, have you? Okay, good. So this side of the room is going to take all these kids in the black T-shirts, and this side of the room is going to take all the kids in the white T-shirts. And you have one simple thing to do. Tell me how many times they bounce or pass the ball. So if they bounce it, it's a 1. If they pass it, it's a 2. How many times does a ball get exchanged? You ready? Black T-shirts, white T-shirts. That's all you have to do. Okay. Black T-shirts, how many times? 20? 14? 9? 12. Did you all watch the same video? You all looked at the same thing and you saw it differently. All right, let's see if you guys did better. 18, 11, 9, 18. Okay, so we all looked at the same thing and we can't agree on what we saw. Right? Now I want you to raise your hand. Just raise your hand if you saw something different, something else. Okay. So you saw a gorilla. Did everybody see a gorilla? Who didn't see a gorilla? Do you believe these people? Are they for real? Let's see if they're for real. You're solving your little problem. You're in the weeds. You can't get out. Here comes the gorilla, says hello, moves across the screen, right? What lens are you seeing through? We're all looking at the same thing. We can't figure out how the ball bounces. We don't even see the gorilla go by. This lady, we're going to put her on CSI because she obviously sees things. So you get the message, right? All right. Perception. This guy will be my patient Monday morning. And this kid, hey, ain't this great? Wow, I mean, I'm going to have a heart attack any second now. All right. So we're going to learn in the next section what we call heart math. And I know you've already had some. You taught them a little bit of heart math. Great. Only the ones that came to that great session? Okay, that Kimberly did. The first thing you always have with you is exactly what the Tai Chi instructor said this morning, the breath. You don't have to have a turban on your head and go to a class or anything like that. I'm going to teach you 2 simple breaths. The first one will take you down really, really quickly. Let's say you're feeling anxious or you're about to say something you're going to regret. You know when it's coming out of your mouth and you have to stop yourself. So you take, whenever your in-breath is shorter than your out-breath, you put your body into a state of relaxation. So just do 4 seconds in and 7 seconds out. And 4 seconds in and 7 seconds out. Do you notice anything different? Calmer. That was only 2 breaths. Imagine if you did that whenever life starts to fling you a curveball, or you have to go to a meeting that you don't want to go to. The second breath is what we call a heart-centered breath, or a heart-focused breath, where you take a time out from whatever the stressful situation is. You don't even have to leave the room. And you start to just go right. You take the longest journey, which, as I learned from Rowney, who's one of our wonderful nurse healers, the longest journey is the 18 inches from your head to your heart. And you go to your heart and you imagine you're breathing in and out through your heart. 5 seconds in, 5 seconds out. And as you start to do that, you'll begin to feel your body also go into a state of relaxation. And then you think about something or someone you love. It's hardly ever your spouse. It's usually your baby, your grandbaby, your kitty, or your puppy. You think about something that elicits that unconditional love feeling. Who has grandbabies here? Right? I mean, is that it? So you think about that. And all of a sudden, then you focus. You lock in on that while you're doing your breathing. And then toward the end, you ask your heart, how might I handle this situation that I have? And eventually the answer will come. But it diffuses the stress response instantaneously. The research shows that learning these simple techniques reduce headaches, improve arrhythmia, reduce muscle tension, help you sleep better, and help with body aches. And Kimberly's a heart math instructor, and you're lucky to have her right here in her home community. Sacred words, mantras, are another thing that you can do. The mantra is a repetition of a word like Shalom, Rama, Jesus, Prince of Peace, whatever resonates with you. If you put that word in your head all day long and you get your brain to do that instead of monkey brain, which is monkeys, you know how monkeys go from branch to branch? That's what our brain does. We go, oh, I got to get the groceries. I'm so pissed at what happened 10 years ago. What's going to happen in the future? Right? This is what our brain does. If you find a mantra that resonates for you, the research out of the VA hospitals, believe it or not, on post-traumatic stress disorder, show marked improvements in sleep, sense of well-being, less stress, less anxiety, less fear, just by repeating a word. The only time you don't do it is when you're doing a complex calculation. But if you find the word that works for you, I promise you, it'll be the hardest thing you ever do, which is to learn to say that word over and over again. and eventually it starts playing in the background of your life. And when you need it, it's always there. It improves heart rate variability, decreases the sympathetic or exciting nervous system response, just by repeating a mantra. Simple medicine. This is the list that was used by Jill Borman, who's a nurse at the VA hospital. This is from her research study. My God and my all, right? Ave Maria, Hail Mary, Rama. It doesn't matter what your tradition is. Find something that resonates with you. Maybe it doesn't come out of a spiritual tradition. But if it does, just play that over and over again. Meditation. And we'll do a mantra later on. Meditation, research shows, get this, 48% reduction in heart attack, stroke, and sudden death, right? 20 minutes of meditating a day, right? So when I grew up, anyone here grow up Catholic? We were taught the rosary, right? Why do you think we were taught the rosary? I didn't know. But it's the best thing for monkey brain, right? Because when you're doing 10 Hail Marys, you can't be thinking about your grocery list and all this other stuff. It's calling on the divine, and it connects you to something that has meaning and purpose in your life. I'm not here to convert anyone to anything. Find what works for you. But when you start to call the divine into your life, if you believe in that, it's powerful, powerful medicine. So when you look at any spiritual tradition, Judaism, Hinduism, Catholicism, or you look at a philosophy like Buddhism, repetitive prayer is there over and over and over again because it takes us out of monkey mind, connects us to a higher power, and reminds us that we're connected. Right? Does that make sense? So I invite you, if this resonates with you, to start with this, because once you start to have that inner peace, all of a sudden you say, I don't need those donuts for comfort, right? And my body is my temple. You start to shift the way you think. And I always think of it this way. I say, we tend to talk to God. Oh, God, help me. Give me this, give me that, give me this, give me that. We're always asking for something. And meditation is getting quiet and listening for the answer, right? Where's the answer? It's there, but we're just too busy. Our circuits are too plugged up to hear it, right? So that, to me, is why this research, which, by the way, came out in the American Heart Association, November 2012. That's how good the research was. Even the American Heart Association couldn't poo-poo this study, because basically what it's doing is helping people get to that path of inner peace. So meditation is important. So we'll end with this slide, which is our reminder slide. Hey, is this great traffic or what? Can I control it? I don't think so, right? Serenity prayer and everything else, changing our perception. What lens do we see through? Looking at what's important to us. And you heard the old saying, don't sweat the small stuff. We sweat the small stuff all day long. What's the big picture? What's my purpose in life? What's my soul's mission? Whatever resonates with you. And then just know that this physical body that you have, this is what you have this time around. We've got to take care of it, right? This is the coat that some of us believe our spirit is wearing. And what kind of coat do we want to wear? What kind of coat did we come here to do our soul's work in? And do we want to feed it hot dogs and orange juice and donuts? I don't think so. I think we have to change our perspective. And that's what keeps us healthy. So thank you for your attention. I'll show you a picture of Ron. All right. And I have to share one thing. I said to Ron, Ron, what made you do this? And even after all my years of doing this, I thought he was going to say tenacity, commitment, all this stuff. He said, Dr. G, I learned to love myself. I learned to love myself. He said, I used to look in the mirror. These are his words. And I'd say, you fat pig. He said, I had no love or respect for myself. And he said, the minute I started to love myself again, I started to do all the things. And you know, we have a saying that information, I gave you a lot of information, or some information, leads to knowledge. We have no shortage of self-help books in the United States of America, right? You can go on the internet, you can get all the knowledge in the world you want. But practice leads to transformation, right? So how do I put some of these things into my life? Here's a lot of resources on both of my websites, food handouts, all sorts of things that hopefully can help to guide you on your journey. And I really thank you for inviting me here today. So thank you for your attention. Thank you. Thank you. Are we doing questions or no? Because I know you have a break now, right?
Sure. There's time for questions.
Okay.
And there's prizes at this session. So if you're interested, you might want to hang around just a few minutes. There will be no prizes later.
Dr. Guarneri, you talked a lot about nutrition and phytonutrients, and the question that I have, because there are there's a lot of information out there about phytonutrients and using the magic bullets and blending it all up in the blender and drinking it. So what are your thoughts on that as far as nutrition goes?
Yeah, I always think you should eat whole foods. So the question is, I don't know if this is on. The question is, should we put our food in a blender and blend it up and have it that way? I think you need to eat whole foods, foods that are not in packages. And you need to shop the perimeters of the supermarket, get all your green leafy vegetables, your whole grains, your broccoli, your kale, your quinoa, your wild fish, your wild salmon, your legumes, your lentils. I don't opt to buy anything in a package unless I absolutely have to. Why? It's filled with salt, and anyone who has high blood pressure, the issue is not only the sodium, but the lack of potassium. So it's a sodium-potassium imbalance. So if someone has high blood pressure, we say less than 1,500 of sodium. If you don't open a package, you're not going to get that. Fresh fruits, right, that are low in sugar, like apples, berries. You could do a green drink if you want. I do not recommend fruit juice because it really spikes up the insulin very quickly. I'd rather see you eat the whole fruit, the whole apple, the whole pear, the whole orange. And I don't think it's very complicated. I think people have tried to make it complicated because that's what generates money in business, right? But if we go back to basics, if you say, I want to decrease my weight, for example, you're going to get off the carbs and the sugar. And the first thing that's going to go is all the white stuff. Your mantra is, I'm not going to eat anything white. I'm not going to have white bread and white rice and white pasta. And come off the dairy, which I know is hard for a lot of us, but it's got a lot of calories. And so going back to simple whole food diet, to me, is the first big step. You know, and like I teach my patients, don't dip a chip in your hummus, dip a carrot in your hummus, dip a cucumber or a celery stick, munch on celery sticks, munch on radishes, if you're like that patient I talked about. It doesn't always have to be a chip. You could put something else in your hummus or and so on.
One more question?
We have to get to the prizes.
Everybody's itching for the prizes. Okay, let's move on.
Thank you for coming.
Okay, you're well. Thank you. Thank you.